The following segment is sponsored by Granger Medical. We are here at Granger Medical Women's Murray Health Clinic talking with Dr. Rebekah Clifford. Okay, Rebekah, what kind of doctor are you and what services do you offer?
So I'm a dermatologist, and I do full skin checks looking for skin cancer. I look over every part of the body, and I use a special light called a dermatoscope, and that essentially lets me look very closely at the skin lesion, looking at what we call the pigment network, and it helps me decide which lesions I need to remove. So I do skin biopsies, I do mole removals, I excise or cut out skin cancers, as well as benign lesions such as cysts and things that you might see on Pimple Popper MD, if you know what that is.
Which is kind of popular right now. Yeah, so you cover it all.
I do. I also do cosmetic procedures, chemical peels, anything to do with the skin I can do, rashes, tumors, any kind of growth, lesions in the mouth or genital area, hair loss, nails. I can evaluate all of those things. And I see newborns and up.
All ages.
Yes.
Okay, let's talk about skin cancer specifically. If we're concerned about a spot on our body, should we be doing an overall check at home or should we come into the professionals and come see you?
Well, we do like patients to have a baseline full skin check by a dermatologist, and he or she might recommend one more often. However, we like patients to do their own skin exams. So every 3 to 6 months, we like patients to look head to toe, looking at every part of their body, having someone help them if possible. What they're looking for are what we call the ABCDEs of melanoma.
Okay.
So these are criteria that we give to patients as well as primary care providers to know what to look for. So A is for asymmetry. So if you fold it in half, does one side look like the other? So if it has a dark border on one edge or it's red on one edge,
it's
that
not
can
a
be
circle.
more concerning, right?
Okay.
So that's the borders part.
Okay.
C is for color. So if there is a very black lesion, that could be concerning. But also if there are several colors, red, black, blue, that would be more concerning. D is for diameter. So anything bigger than 6 millimeters, and that's about the end of a pencil eraser, could be concerning.
Okay.
And then the E actually is the most important. So that's if anything is changing over time, getting darker, getting bigger. We also have a little criteria that we call the ugly duckling syndrome. And so if you have one that does not look like your other spots, and certainly if it's changing, that could be more concerning.
It's kind of mismatched. Okay, what if we come in, you find something a little concerning, what are the steps we take after that?
So if we find a lesion that we need to biopsy, or if you have a mole that you want removed, for instance, the procedure is very similar. So we numb it up right there in the office with just a little bit of lidocaine, and I usually shave it off either superficially or flush with the skin, and it's got a good cosmetic outcome. Also, takes a few minutes. We do it right there in the evaluation, so we know, and we know within a few weeks what that biopsy will show.
Oh, that's so nice. What I love is a one-stop shop. Basically, you don't have to go to other places to get it removed. It's all done here.
Right.
Which is so nice. Okay, what do you love about what you do? Helping people, I'm sure, and saving lives probably.
Well, I love how different it is. So I get to see, little kids. I get to see patients of all ages and types. And it's so different. Each case is different. So I see acne, I see skin cancers, and I see rashes. I love that I get to help people and quickly. So, you might see your provider for your blood pressure, but it takes some time where I get immediate results, and that makes people happy, and it makes me happy.
Oh, well, you're making everyone happy by saving their lives, too. Dr. Rebekah Clifford, thank you so much for joining us today.
Thank
and all
you.
the information's on your screen if you need to make an appointment.